Ginger roots have been used for more than 4,000 years in traditional medical remedies. Ginger's main effect is its anti-inflammatory action. It's especially effective for osteoarthritis and muscle soreness. Ginger works because it contains gingerols and sugars, which are active molecules. They are absorbed easily from the stomach and enter the bloodstream within minutes. These compounds reach muscle and joint and reduce prostaglandins, the molecules that are responsible for inflammation and pain. The pain reduction effect looks like a weak anti-inflammatory medication, but no risk to the stomach or the kidneys. Ginger also shows one of the strongest effects in nausea because it affects vagus nerve and serotonin receptors in the gut. These nerves are responsible for stomach contractions and urge to vomit. Ginger stabilizes the electrical activity of nerves and reduces contractions, so it reduces signals from the gut to the brain in the vomiting center. Ginger is effective for nausea in about 70% of pregnancy-related nausea and about 50% of people with motion sickness during car or ship travel. The effect usually begins with 20 to 30 minutes because ginger is absorbed rapidly and it works best when taken before meals or just before traveling, when the stomach is relatively empty and the compounds can enter to the bloodstream faster. Ginger does not sedate, and this is why it helps without causing drowsiness, unlike many anti-nausea medications. Ginger also improves digestion because it gently increases movement of stomach and small intestine. When the stomach is slow, food stays longer and create gas, pressure, and feeling of heaviness and bloating. This effect is noticeable in about 30% of people, especially who feel bloating and pressure after eating. This effect most noticeable when ginger is taken right before a meal or immediately after eating. Ginger also has a clear heating effect because its active compound stimulates the same heat sensor receptors that react to warm temperature. When these receptors activate, blood vessels in the skin open slightly and circulation increases. This is why many people feel gentle warmth in the hands, feet, and face after ginger tea. It is not imagination, it is real physiological effect. This warming effect improves comfort in people who are sensitive to cold or who experience slow peripheral circulation, and it also relaxes smooth muscles in the digestive system. For many, this warming sensation appears within 10 to 15 minutes, especially when ginger is consumed fresh or as hot infusion. Another important real-life effect is ginger support during menstrual pain. During menstruation, the body produces prostaglandins, which trigger uterine contractions and cramping. Ginger reduces prostaglandins in the same way it reduces inflammation in joints. Because of this, ginger can decrease menstrual pain intensity 20 to 25% in the first 2 days of the cycle. For many women, this effect is comparable to mild anti-inflammatory medication, but without the risk of stomach irritation. The effect is most noticeable when ginger is taken at the very beginning of cramping because this prevents prostaglandins from building up. Ginger is also commonly used for common cold symptoms because its warming effect, antiviral activity, and improved circulation helps the upper airways feel less congested. It does not cure infection, but it eases throat discomfort and reduces feeling of internal coldness that often appears at the start of viral illness. Ginger also increases saliva and mucus clearance slightly, which helps people to feel dryness or throat irritation. One more common usage is supporting blood sugar control because ginger improves post-meal glucose level by about 10 to 15% in some people. It slows the rate at carbohydrates breakdown and improves insulin sensitivity in moderation but measurable way. The effect is useful for people who experience blood sugar spikes after eating. The best dosage for general health, inflammation and digestion is usually 1 to 2 grams of ginger daily, which equals about half a teaspoon of dried ginger and 1 to 2 thin slices of ginger root. For nausea, the most effective dose is around 1 gram taken 20 to 30 minutes before meals or traveling. For menstrual pain, studies show the best effect is 1 gram 3 times per day during the first or 2 days of the cycle. For muscle soreness or osteoarthritis, 2 grams often give the most relief and stable effect. It's important to consider safety. Ginger is extremely safe for most people, and more than 95% of people tolerate it well. The only caution is very high dose, about 4 grams daily, can cause heartburn or mild thin blood. People taking strong anticoagulant medication should avoid very large supplement doses. Normal culinary amount are usually safe. Ginger can be taken in different forms, but most common and practical one is fresh whole root, because it contains highest amount of natural gingerols, which are responsible for strongest anti-inflammatory and anti-nausea effect. When ginger is grated, sliced or crushed, these compounds are released and absorbed quickly. Fresh ginger also provides warming sensation much faster than dried forms. Many people use in the tea, meals or chew thin slices because it allows steady absorption without overwhelming the stomach. Dried ginger powder is also widely used because it's convenient and stable. When ginger is dried, part of gingerols convert into sugars, which are more intense and stronger in warming and digestive support. This means dried ginger often feels spicier and can stimulate circulation faster, but anti-inflammatory and anti-nausea effect is slightly softer compared to fresh roots. For people who want digestive support, after eating, dried ginger is often more noticeable. Ginger extracts in capsule are another common form, and they are used for precise dosing. These extracts contain concentrated amount of gingerols and sugars, which makes them effective for nausea, menstrual pain, and osteoarthritis. When someone prefers consistent dosing without the taste, extracts deliver the most predictable effect because amount of active compounds is standardized and absorption is steady. This is why many clinical studies use capsule rather than fresh ginger. The best practice depends on the goal. For nausea or travel-related sickness, 1 gram of ginger extract or 1 small slice of fresh ginger about 20 to 30 minutes before the trigger works best because absorption is faster or on empty stomach. For digestive support or warming, fresh or dried ginger in tea is often the most comfortable method because warmth enhances circulation and helps relax the gut. For joint pain or muscle soreness, daily intake is more important than form. 2 grams per day, any reliable ginger form is usually enough to reduce prostaglandin activity. Ginger also has other names. It is known as Zingiber officinale, which is botanical name, and in many cultures it is simply called root ginger, shoga, or adrak. All of these refer the same plant. Traditional medicine is considered both spicy and therapeutic root because it can be used whole, dried, crushed, powder, or extract. Ginger can be used as whole root, which provides wide range of natural compounds, including fibers and aromatic oils that are not present in refined extracts. These extracts, however, provide concentrated form of gingerols, which make them suitable for people who prefer precise dosing or who dislike the taste. Both methods are effective, but whole root gives a broader, slower and more gentle effect, while extracts give sharper and more targeted action. There are also interesting details that many people don't know. Ginger's anti-nausea effect works even if person cannot taste it, because its action comes and happens in the bloodstream and in the gut's receptors, not in the mouth. Another detail is that ginger anti-inflammatory effect improves slightly when combined with small amount of fat in the meal, because it compound dissolve better and reach tissues more easily. Ginger also continues converting gingerols into sugars during storage, especially if kept at warm temperature, which means older dried ginger often feels stronger than newer batches.